name is Jill Elderkin, and this is my submission video for the thorax and abdomen assessment. This is the room. I have no study aids out. Okay. Alright. So, first I notice on the posterior superior portion of the back of the thorax that there are several primary lesions in the form of moles and some freckles scattered on the top. The spine appears midline when the patient inhales. The inhalation on both sides, the clavicles and scapula appear symmetrical. I'm going to percuss. And resonance is heard with that. I'm going to ask you to say 1, 2, 3 when you feel my hands. Ready?
1, 2, 3. 1, 2, 3. 1, 2, 3.
And tactile fremitus is felt throughout. I'm going to go ahead and oscillate over the lungs. And just breathe regular. And vesicular breath sounds are heard throughout. No adventition breath sounds heard, no wheezes, no crackles. Now we're going to assess the diaphragmatic range upon inhalation. So I'm going to go ahead and ask the patient to take a deep breath and exhale. And hold it when you exhale. And just hold it. Okay. Okay, and then I want you to go ahead and take a deep breath, inhale, and then hold it. Hold. Okay, you can breathe regular. And that measures just about 3. The normal is 3 to 5, so this is just under, it's about 2.5. Let's see. Okay, we're going to have the patient sit down over here.
Sit.
Yep, sit. Okay. Alright. Upon assessment of the patient's anterior thorax, just sit up straight for me. We can see that upon inhalation, chest is symmetrical. The umbilicus is midline to the midclavicular line. I'm going to go ahead and ask you to say 1, 2, 3 when you feel my hands again.
1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, and tactile fremitus is also felt there. I'm going to go ahead and oscillate your lungs again, only on the anterior portion of your thorax this time. So just take a deep breath. And you can actually breathe regular. Okay. And the patient denied any tenderness upon palpation of the posterior thorax. Do you have any tenderness when I palpate any of these areas?
No.
Okay, and just put your hands over your head like this for me and take a deep breath. And again, everything is symmetric upon inhalation. You can go ahead and lay on your back. Okay. And just breathe regular. Actually, if you could scoot down and have your head flat. Okay, it's okay if your feet are up a little bit. Okay. Okay, skin is warm and pink and dry. Several scattered freckles throughout, a couple moles on the upper lateral aspects of the arm, the superior lateral aspects of the left arm. Pulsations noted in umbilicus area, midline. I'm going to go ahead and oscillate for any rubbings. See. We'll go ahead and listen to the left renal artery and right renal artery. Okay, and the iliac. And we'll defer the femoral arteries. We're going to go ahead and also tape for bowel sounds. And there are positive bowel sounds on all 4 quadrants. The tissue, the breast tissue is non-tender, no lumps felt, no discharge noted. We're going to go ahead and listen for tracheal breath sounds. Alright, and we were able to hear tracheal breath sounds around the trachea and bronchial breath sounds, bronchiovesicular for the most part when listening anteriorly to the lung sounds, and some vesicular. We're going to percuss the abdomen. And you can see there's a difference when percussing the abdomen where there's tympanic sounds, and when you percuss over the liver, there's more of a dull sound. So we're gonna go ahead and measure the liver upon, let's see, we'll percuss the thorax first. And inhale and hold. Okay, you can breathe regular. And that's just about 5. And the normal for that is, I believe, 5 to 10, according to the textbook. Okay, I'm going to go ahead and palpate for any tenderness. Any tenderness?
No.
Okay. There are no bulges or lumps or any irregularities noted upon palpation. When percussing over the abdomen like we did before, it's tympanic sounds. Over the bladder, it's more dull. Let's see. Okay, and we're going to palpate for the liver. So if you could just cough. You can feel the edge of the liver, and there's no ridging on the edges or anything. It's smooth. And then if you could just, it might be hard because you're on a couch, but I'm going to kind of let me lift you up. And we're just feeling for the kidneys on the posterior side. Okay, and I'm going to defer on the other side. So we were able to palpate the kidneys and the liver. No irregularities noted, no tenderness. Patient has no complaints of pain. Breath sounds were regular with a rate of 16 to 18 a minute. Again, no crackles or adventitious breath sounds were noted. Upon percussion, the abdomen had tympanic sounds, and over the organs such as the liver was more of a dull sound, and resonance was heard upon percussion of the intercostal spaces. Both anteriorly and posteriorly, upon inhalation, the chest and back were both symmetric. And I believe that concludes our assessment of the thorax and the abdomen. And I'll go ahead and do another 360 of the room. Okay.